Thank you for joining this WHO EPI-WIN webinar on dengue, current epidemiological situation and response. So before we begin this webinar, some housekeeping. The webinar is being live streamed on the EPI-WIN YouTube channel. The webinar is being recorded. This recording and presentations will be available on our website and shared with all webinar registrants. So we invite you all to post your name, location, and organization in the chat box. We'd love to hear where you're joining us from. Please also add any questions you may have in the Q&A box, not in the chat, so we can more easily keep track of them. I'll now hand it over to Dr. Diana Rojas Alvarez to moderate this webinar. Over to you.
Thank you very much, Adrish, and good morning, good afternoon, and good evening, colleagues. Welcome to this new edition of the EPI-WIN. So today we will be hearing about the current global situation of dengue. We have several speakers from the WHO HQ and also from some of the countries. As you know, dengue is a mosquito-borne viral disease that is most widespread globally. And in 2023, it was reported in all the 6 WHO regions. In early December 2023, we declared a global emergency, anticipating high transmission in 2024, and the emergency response is still ongoing. So you will hear more details about the epidemiological data and also the emergency response. As you also are aware, climate change has a direct impact on the transmission of dengue and other arboviruses, as any of the changes in the environment will speed up or down the mosquito's ability to transmit arboviruses and will drive further expansion in latitude to the north and southern hemisphere, and also by altitude, because the mosquito is being found every time higher and higher in the mountains. WHO has the responsibility to ensure that countries can prepare, prevent, and early detect and control dengue outbreaks, including all the critical components of arboviral diseases. So without further ado, I welcome you all again to this EPI-WIN. And let's start with the opening remarks from my colleague, Dr. Raman Velayudan, who is the unit head of the vector control unit in the neglected tropical diseases department here at WHO. Dr. Raman, over to you.
Thank you very much, Diana. Good morning, good afternoon, or good evening, everyone. It's really a pleasure to participate in this webinar, which is basically going to address the current epidemiological situation and the response. One of the key questions which everyone gets asked today is, why is there this increase of dengue cases? And there are several factors responsible to it. Number one is the climate change. Today we know that there is a lot of climatic variability, and El Nino phenomenon is affecting parts of the Pacific as well as the Indian Ocean. The oceans are getting warmer. So the warmer conditions really favors the mosquito. They multiply much rapidly. And at the same time, the virus in the body of the mosquito also multiplies. So this has really helped the spread of the disease. The second point is the changing distribution of the vector mosquitoes. The Aedes mosquito has spread to well over 150 countries today. And this is not really being tracked because we were not aware that they are silently spreading to many unaffected areas. And with the variation in temperature, favorable temperature, they are really spreading further south as well as to unknown territories where they have never existed previously. And this also includes parts of Europe. The third important point is the weakening health system. After the COVID pandemic, we have a health system which is really coming up to stream, and in many places we have to rebuild the capacity. The surveillance system is still catching up, and there is a lot of, this outbreak was really triggered end of last year and has continued to affect a large population. The fourth factor, of course, is after the COVID restriction, there is a large movement of people. So basically, the asymptomatic carriers of the virus are taking the disease both within the country and beyond. The last point I really want to address is that there is also the problem of concurrent outbreaks of other arboviruses. There are countries which are affected by chikungunya, Zika, and Orupuchu. And of course, if they are all suspected as dengue, then the reporting system reports it as dengue. So this is also a challenge we are facing with. The other important point I really want to highlight is the need for countries to get prepared right now, especially in the Asian and African region, and a programmatic approach to sustain some of the interventions would be ideal. Before I open open this whole seminar, I really want to highlight also that I am quite aware that the Association of Southeast Asian Nations, the 10 countries of ASEAN, would be celebrating their Dengue Day on the 15th of June. And they have a team to committed to fight against dengue, raising the awareness to a highest level. So I really hope that this is a real call, wake-up call for most of the regions of the Asian region, mainly where the threat of dengue and arboviruses are just going to begin during and post-monsoon. And we seeing what has happened already in parts of Latin America, which you will see during this webinar. We hope this can raise a greater awareness and get countries fully prepared. So thank you very much for this opportunity. Over to you, Dan.
Thank you very much, Raman. And now I will give the floor to Dr. Maria van Kerkhove, who is the Acting Director of the Epidemic and Pandemic Preparedness and Prevention Department here at WHO. Dr. van Kerkhove, over to you.
Thank you, Diana, and hi, everyone. I'm sorry I'm a little late for the start of the EPI-WIN. Just adding my warm welcome to all of you. And just to add, to supplement some of the remarks that Raman has made, I know you are going to be hearing about the global dengue situation, and you know about dengue, so I'm sure Raman mentioned this, but as a mosquito-borne viral disease, it's widespread and it's global. And in 2023, it was reported in all 6 WHO regions, so across the globe. This year started with a large dengue and chikungunya outbreak in South America, followed by expansion in the rest of the Americas, Southeast Asia, and the Western Pacific. During the summer months, we saw dengue cases reported in Europe, and since October, the rise in cases in West Africa was observed. So with this increasing transmission, in early December 2023, WHO declared what we call a dengue grade 3 emergency, anticipating high transmission in 2024, and the emergency response is still ongoing. It's very complex, as you well know. The complex nature of dengue and also co-circulation of other arbovirus transmission can't be prevented by the health sector alone. It requires multi-sectoral collaboration involving all levels of government and all levels of society. This is really what we mean by a One Health approach. Climate change is having a direct impact on the transmission of dengue and other arboviruses, and we see that any changes in the environment speed up and down the mosquitoes' ability to transmit, and we do see changes in the coverage of the vector as they move further north and further south in terms of latitude and altitude, and they're transmitting in new areas with large susceptible populations, and this is the key. We also see changing seasonality patterns in endemic areas. And for example, we've seen dengue season starting 1 to 2 months earlier. And this is really important for prevention aspects in terms of risk communication. Some populations may think, well, this might not be the dengue season or the mosquito season, but in fact, things are changing. So we at WHO have the responsibility to ensure all countries have the ability to prepare, especially to prevent, to detect early, and to control dengue outbreaks, including using all of the critical components that are necessary to tackle arboviral diseases. This includes epidemiologic surveillance, laboratory diagnosis, quick early laboratory diagnosis, early clinical management and care, entomological surveillance, vector control, and of course, risk communication and community engagement. Again, you have heard through the EPI-WIN seminars that outbreaks begin and end in communities, and communities can actually prevent these outbreaks from happening in the first place if they're well informed and equipped and have the right information and the ability to protect themselves and their loved ones. In 2024, so far, more than 7.5 million cases have been reported. And we know that there are more cases that are out there. You're going to hear much more about this during this webinar, as well as get some specifics on the dengue situation in Mauritius and Brazil, 2 countries that are heavily affected by dengue during 2024. I want to thank all of the people involved in organizing this webinar. I want to thank all of the people at WHO, Ramon, Diana, and many others, especially across our incident management support team. I see Awa online as well, in support of all of our member states. And a special thank you to our regional colleagues who we sit here in Geneva, but all that we do in support of our member states is through our region and our country offices. So there's a huge group of people that are working on dengue, working collectively, working collaboratively to tackle this huge global problem. Diana, back to you.
Thank you very much, Maria, for the welcoming remarks and for thanking all the colleagues and partners all over the world. So now let's get started with this EPI-WIN. And now I will give the floor to Dr. Martina McMenamin, who is an epidemiologist in the Acute Event Analytics Unit at WHO in the Health Emergency Program. And she's the EPI lead of this grade 3 emergency. And well, she's going to share with you all the amazing work that the team has been doing on the dashboard, on the dengue dashboard. So without further ado, Martina, over to you.
Okay, thank you so much, and thanks for the opportunity to be part of this today. Can you confirm that you can see my screen? No?
We can't. We can now. Yes. Now we can. Yes.
Okay, perfect. Thanks very much. So as Diana mentioned, I'm the EPI lead now on the G3 dengue emergency. And we've been working alongside the technical teams who do this programmatic work consistently, and we've just come in to support them to try and bring together a kind of global dengue surveillance system. Globally, we have so far by the end of April, 7,890,546 cases reported. So this is only as of the end of April, and we know from the more up-to-date surveillance in the Americas that it's actually close to 9 million cases now and 4,000 deaths. So in this global reporting system, countries and regions will be reporting on a monthly basis. So we're planning to see this more real-time situation of dengue because of the rise in importance. So at the moment, we have 79 countries reporting those cases, but in total, we've captured 161 countries or territories in the surveillance system, so 82 of which are zero reporting for 2024 so far. So you can see here in the table, the regional breakdown. So you can see no autochthonous cases have been reported so far in the European region in 2024. And the region of the Americas accounts for 7.7 million of these cases. However, it's really important to flag here that the surveillance system in the Americas is extremely well developed, and we're still building the surveillance system in regions outside of the Americas. And also they've had their peak season in many sub-regions there already in 2024. Another thing to flag when interpreting this data is that case definitions and ascertainment vary hugely in dengue. So it's true in many diseases, but we have many countries and regions using different case definitions. Some are reporting cases only that were hospitalized, whilst others are reporting suspected cases. So it's really challenging to compare across countries. If we look at the regional trends so far in 2024, you can see the region of the Americas in the first 3 months had this huge peak, which is now plateaued. And in other regions, such as the African region, Southeast Asia, and the Western Pacific, we've had this decline in trends. However, in many countries, the season is yet to happen this year. So we expect to see increases as we go later into the year as well. This is the geographical spread of reported cases that we have so far captured in the surveillance system. This is not everywhere that we know there is dengue. So you can see in the light blue, a lot of these countries in the European region and Canada are so far reporting zero autochthonous cases. And we can see in terms of total cases, heavy burden in the Americas. And the aim is, as we develop this surveillance system, to add more countries over time. So in terms of the highest incidence countries so far, or territories in 2024, we have Brazil is actually third when we look at incidence, although they had 6.2 million cases reported by the end of April. And we have many other regions in the Americas, so French Guiana, Paraguay, and many others that are reporting quite high incidence given their small populations as well. So looking at the global dengue annual trends, you can see here the total reported cases by year and total reported deaths by year. So you can see for the cases, these have been increasing consistently and quite rapidly since 2021. And you can see with data as of the end of April, we have already seen more cases in 2024 than the entire of 2023. And actually, we know this is closer to 9 million now. So really this huge surge globally. If we look at severity here on the bottom left, this is the CFR over time. And we can see it's been gradually decreasing. So with the data we have available, it's not clear that there's any changes in severity. However, this is, needs to be interpreted as it could be an artifact of change in surveillance if cases are being determined differently over time. So just looking for some historical context. So we don't have historical data for many countries and regions, but where we do for many countries in the Americas, you can see that, of course, dengue is endemic in these countries. However, in 2024, we've already seen the highest recorded transmission in the region. And just the figure on the right shows the trends by country. And just to make the point that this is not only driven by Brazil, so that we have other countries in the region that are also recording their highest seasons. So Argentina, Colombia, all high seasons, Dominican Republic, Costa Rica. So this isn't just in Brazil, this is across many countries that we're seeing this pattern. So just looking at seasonality, I know that it was mentioned that we are starting to see maybe seasons beginning earlier, lasting longer. So we wanted to take a look at the data where we have it. So on the bottom or left panel, you can see this is the incidence per 100,000 population by sub-region in the Americas. So on the x-axis, we have the month and the y-axis is the year. So you can see in the southern cone, really heavy high incidence in the first half of the year, and then less so in the second half. However, when we look at the average monthly cases by time period, so in the green, we have 2017 to 2020, the average cases for countries in the region. And then in the orange, 2021 to 2024, you can see that we are actually seeing some changes in when the season begins. Of course, higher incidence, which we know, but also if you look at the southern cone, for instance, the cases started to plateau around June 2017, 2020, whereas we're seeing this plateau July, August there. And also if you look in the Caribbean, we're seeing this kind of earlier peak at the end of the year. So it does suggest that we are seeing some changing patterns, although when we look at this at a country level, there's also some differences. So I think we need to look at this on a really granular scale. Briefly to look at Southeast Asia, so focusing only on Bangladesh, Thailand and Sri Lanka here, you can see that we're seeing a similar picture. So recent high incidence seasons compared to previous in endemic countries, primarily here driven by Bangladesh and Thailand last year. And then if we look at the seasonality in these countries over time, it's not as clear here, the pattern. So you can see for Sri Lanka, we have these two peaks in the year, whereas for Bangladesh and Thailand, it tends to peak later in the year. However, there's no clear change in incidence here, where you can see in the previous years, Thailand had a higher incidence than in recent years. So this is something that we want to investigate more. Just to say, we're also now aiming to integrate Zika and chikungunya surveillance in the global dengue system. So this is something that's already being collected in the Americas and in many other countries, but we want to bring this together to get a clearer picture of circulation of arboviruses. So here you can see in the blue, this is countries that have had transmission of all three viruses recorded at some time, so current or previous transmission. And then the green is the transmission of 2 of the 3 viruses. So you can see co-circulation is happening in many, many parts of the world. And due to this kind of misdiagnosis between arboviruses, we want to build the surveillance so we can tell the difference, diagnose correctly, and get a true picture of what is happening there. So in summary, we've had 7.9 million cases and 4,000 deaths recorded from 79 countries in the WHO surveillance system. The cases recorded by April already exceeded the total of 6.6 million cases reported globally in 2023. And several regions and sub-regions are still to experience their typical transmission season in the second half of the year. Our global surveillance has now captured 161 countries, lots of which are zero reporting. And as I said, work is underway to expand this system to include Zika and chikungunya. Historical data is not routinely available. However, when we look in the data available in the Americas, there is some evidence of this longer and higher incidence seasons in recent years in endemic countries. And finally, so we have now launched the public dashboard. So far for dengue, Zika and chikungunya are not yet on there, but I can share briefly. Can you confirm you can see, Diana?
No, I see still your slides. I was able to see it for a few seconds. Though.
Can you see it now?
Yes.
Okay, perfect. So this is the global dengue surveillance dashboard that is now publicly available. We can put the link in the chat. So you can see here, this is the global overview as of 2024, but there are some additional functionality to look at other years by months. Also, we have tables by region and by country, but importantly, we also have this country and region breakdown. So if we look, for instance, at Brazil, where we have good data, we can see the current situation as of 2024, but also we can look at severity and we can look at some historical comparisons within the country. So you can see it's really clear here, this huge spike in Brazil compared to previous years. And we can look at the changes in case fatality ratio as well. And just to say, there are lots of other functions on here. You can download the data to have a look at yourself. And there's a lot of information around case definitions and other additional information. And there's also an email address where you can reach out with any feedback or any clarifications that you need. So thanks so much. I'll stop there. And back to you, Diana.
Thank you very much, Martina, for sharing the current epidemiological situation and the dashboard. So please share the link in the Q&A so the participants can start looking into it. We have more than 1,100 participants so far. So welcome to the colleagues from all over the world that are just joining this EPI-WIN. And let's continue. So now I will give the floor to Dr. Awa Nadir, who is the Incident Manager for the Grade 3 Dengue Emergency here at the Health Emergency Program. And she's going to be describing briefly the global dengue response and the next steps. Dr. Awa, over to you.
Thank you very much, Diana. And good morning, good afternoon, good evening, everyone. As you may know, next slide, please. As you may know, climate-sensitive disease outbreaks are now seen as the new health crisis, and the global cholera and dengue outbreaks that we currently face are part of it. As described by Martina on her presentation, so the scale of dengue outbreaks and their geographic spread even to countries that were naive from dengue, is very concerning. Given all the challenges that Dr. Rahman has described, and given the lack of funding that we have to prevent and control dengue, since dengue is seen as a neglected tropical disease. So at WHO, we have elevated the response of this dengue outbreak as a graded emergency. Next slide. So as per our emergency response framework, which is our WHO internal procedure in terms of health emergency response. So on December 1st, the multi-region dengue outbreaks was graded at the level 3, which is the highest grading level that we have, and that require a maximal WHO response across the 3 levels of the organization to control the outbreaks. And this grading had triggered the activation of what we call the incident management system that I'm leading, and collaborating with Rahman, who is the technical lead, Diana, who is leading the health operations, and Martina leading the epidemiological surveillance. So 3 weeks ago, we reviewed the grade event. And given the high risk of dengue at the global level and all the challenges that we still face, so the grade 3 was extended for additional 6 months. So mainly this IMST's role is really to coordinate the global efforts to control dengue and to reinforce the regional and the national capacities. And you will see that we have the same structure established at the regional level and also in countries, and we have some of our leads of this dengue response here with us in this webinar. Next slide. Next. So what we have is that the IMST has multiple objectives, but mainly we focus on some priority areas. So the first one is, as Martina has described it, all the work on the global surveillance. So it's really the first time that we have here a clear picture of the global situation in terms of dengue, and it's almost in real time. And we are really learning from some of the regions that have a more robust surveillance system, like the Americas, to strengthen the global system and to provide support to the other regions where the surveillance system either needs to be established or to be reinforced. And as Martina highlighted, so the team is doing an amazing work to integrate all the other arboviruses like Zika and chikungunya into this global surveillance. Next, the second area is all the technical support and guidance that the technical team is currently providing. So they're updating and developing some guidance, so on evidence-based, on clinical management, lab testing, vector control. So we will be able to update those and to publish them very soon. And the team is also working on some tools to be used for RCCE in the communities. So as Maria highlighted in her opening remarks, communities are really a key role to play in this dengue response. And third point, so it's really all the work led by Rahman around the vector control management, which is really critical in the dengue response, and not only for dengue, but all the other arboviruses. And additionally, additionally to all this technical support that we're providing, so the IMST at the HQ level is providing financial support as well. So currently, the financial support is very limited compared to the huge needs that we have from the countries. And lastly, really this having this IMST really help to increase the awareness on dengue and to hopefully to increase donor interest to fund more dengue activities for this response. And just to inform you that we're in the final stage to publish what we call our strategic plan to better prepare and respond dengue and other arboviruses. And after the publication, we'll be able to organize some briefings and to talk more about the WHO work and what we plan really to make the countries more ready to face the coming outbreaks. And hopefully we'll be able to mobilize funds and enhance partners coordination, because we really need to work all together to make dengue a non-neglected disease anymore. Over from my side. Thank you, Diana.
Thank you very much, Awa, for summarizing all the work from the last few months in just 5 minutes. Thank you very much for sharing all that we have been doing in collaboration with our regional office and with our countries. So now let's start hearing some of the experiences or lessons learned and recent outbreaks from our countries. So now I will give the floor to Dr. Aba Judia Juten, who is an emergency preparedness and response officer in the country office in Mauritius. And she's going to be talking about dengue in Mauritius, the recent outbreak and lessons learned. Dr. Aba, over to you.
Hi, thank you. Let me share my slide. Oops. Sorry, I'm struggling to share my slides here. Thank you.
We can see them now, but yes, perfect.
Thank you very much. So I'll be talking about the dengue situation in Mauritius. Some of you might know Mauritius is a very small island which is found in the center of east side of the Indian Ocean, and it has got a population of around 2.5 million. Next slide, please. And dengue is, Mauritius is part of the African region. So going back to the African region, as you can see from the table, and as my colleagues mentioned, the African region has been highly affected by dengue as well. And we can see the figures from 2023 and 2024. In 2023, there has been 117,530 confirmed cases, and although 2024 has been better, but the cases are still there. If we look at the chart on the right, you can see the areas which are widely affected by dengue, and they include the Burkina Faso, Ethiopia, Sao Tome and Principe, and Mauritius, as well as Mali. Next slide, please. So in the African region, we've had the incident management support team set up, which has been a huge support for countries like Mauritius. It led to enhanced coordination in the health emergency and control of dengue, and we've had the support from various vector control specialists. There has been also a 5-day dengue webinar series, which had involved more than 500 professionals from the 50 countries. Afro region has supported with operation support and logistic, and led to the dispatch of essential supplies amounting to around 187,000 USDs. And Mauritius has received some of the funds as well, some of the support. Financial allocation, why the countries who received the CFE funds have been Burkina Faso, Cape Verde, Cote d'Ivoire, Ethiopia, Mali, and Mauritius, and up to 1.8 million from the WHO CFE money has been allocated to these countries. There has been also the development of a comprehensive preparedness and response plan in all the 3 languages, the English, French, and Portuguese, that has been provided for support. we have had support of various specialists in entomology, vector control, epidemiology, and risk communication. All of them Mauritius has benefited from. Next, please. So there we go, back to Mauritius. Mauritius is a small island, a very tiny population of 1.27 million, and it consists of, the Republic of Mauritius consists of 2 islands, Mauritius and Rodrigues. The urban population accounts for 40%, 42%, while the rural population is around 58%. The most important thing about Mauritius to know is we rely very heavily on our tourism industry. It's a small island development state, and our tourism is vibrant with up to 1.4 million tourist visits in 2024. And it is predicted that the number of tourists visiting the island will go up. Coming to dengue itself, Mauritius had eliminated dengue till the 2009 outbreak. And since then, we've had a couple of outbreaks which have been ungraded, minor, and very well localized, geographically, easily contained within a couple of weeks, sometimes not even months. However, in 2023, the outbreak that has started again was contained in the few months. But however, at the end of 2023, there was another outbreak which is still continuing and led to the buildup of cases till now. So we've got a prolonged and unforeseen outbreaks, the first time ever in history that Mauritius has faced such an outbreak. And when we think back about the factors that might have contributed to the outbreak, it resounds with the several factors mentioned earlier. Climatic changes, because Mauritius being tropical, the tropical country is highly affected by the climatic changes, and recently we've had cyclones and floods that could have further contributed to the current dengue situation. Next, please. So since 11 December 2023, there have been 8,943 cases reported, and 9 deaths directly related to dengue, while 10 other cases were related with patients who had dengue, but they died of other causes. In Mauritius, the only vector contributing to dengue is Aedes albopictus, and the only serotype that has been detected in Mauritius so far is the serotype 2. Saying that, as we mentioned before, Mauritius is a highly touristic country, and we've got dengue around the world, different strains of dengue around the world. So we could be expecting another serotype anytime now. There has been lots of evaluations and situational analysis conducted by entomologists, epidemiologists, and experts who have come from WHO to support the response in Mauritius. One of the key findings have been that the transmission is driven primarily via small and medium containers in private residences. It hasn't been the mosquitoes in the wide and open areas, but really contained. And Rodrigues, sister island of Mauritius, has got around 44,000 inhabitants, and out of the 44,000 inhabitants, there are more than 2,000 cases of dengue that has been reported till now. So you can clearly see it's a very high attack rate, both for Mauritius and Rodrigues. So we can see the epi curve here. Overall, we peaked around in February time, and the curve is now coming down after all this, the activities, the response activities led by the Ministry of Health with the support of the WHO country office, regional and headquarters as well. Next, please. So response according to pillars, the emergency coordination has been led by the Ministry of Health, and WHO has been consistently present to coordinate any deployment, any need for support. Surveillance, all the cases are reported within 24 hours, and they are picked up by the IDSR reporting, which is being upscaled in the country, although we haven't met the 90% target, but we are on the way to the 90% target of IDSR. Our detection rate is very good, as long as we've got the facilities. At the beginning, the country did not have enough RDTs, but once RDT availability has been established, all cases are confirmed within a couple of hours using RDT at facility level. There are only selected cases which actually undergo PCR, but lab-wise, the lab is very well equipped. They've got experts to detect cases of dengue. Vector surveillance is conducted by the Vector Biology Division, which has got a very well-equipped unit with the staff. Obviously, more could be done there, and they use the Brito Index to help with the vector surveillance. This eventually guides vector control activities. Most of the time is synchronized, but at some point we do have some occasions where synchrony could be further improved. Case management, I think the highlights of case management here is most of the cases, more than 80% of the cases are managed at home with the support of domiciliary medical unit. Any patient diagnosed with dengue will have a risk assessment done and a decision will be taken whether the patient will be admitted or seen at home. And if they are seen at home, they will be supported on a regular basis by the domiciliary medical unit, who will provide care, supervision, and observation of vitals. And if the situation changes, obviously they will be reverted back to the hospitals. Risk communication and community engagement. It has been a little bit slow to start with, but eventually caught up with more and more programs on the radio, on the TV. Most of the RCC campaign have been centered around the distribution of leaflets, but there has been training of trainers for RCC, and there have been people have been mobilized, ensuring sensitization on dengue, but this is a work in progress. OSL, we've had, I think Mauritius thanks the World Health Organization for the support that OSL supports received, because at one point there was no access to RDTs, and there was a good coordination to ensure that RDTs are being sent to Mauritius at the earliest. Next one, please. And response wise further, we had the support of entomologists expert in vector control, and they supported the training of more than 3,000 officers, and they visited all the site. They looked at the breeding site. They also looked at the behaviors of the mosquitoes, and a comprehensive situation analysis and recommendation have been provided to the ministry. We received CFE funds amounting to 250,000 USD, which is provided to the ministry to support the response. And funds have been also used to provide OSL as described here, RDTs, creams, insecticides, respirators, sensitivity kits, and also support for lab strengthening, including PCR, genomic sequencing, and vector labs. We also receive support and guidance in the development of dengue CITREPs. Next, please. One of the key contributors to dengue in Mauritius has been related to insecticide resistance. So after a month of negotiation, we finally received insecticide resistance kit, and insecticide resistance study is currently underway. We await all the results, which can be used to determine what insecticides can be used to prevent the further outbreak of dengue. This is currently underway. Risk communication and community engagement has been identified as a gap by the various experts, and a risk communication and RCC plan has been developed by expert deployed from the regional office, and it led to the development of the action plan, which has now been validated, and we're hoping for a rapid implementation. We also have developed the integrated vector management strategy, the insecticide resistant management strategy, and
sorry to interrupt, Dr. Abba. Could you please wrap up a little bit, because we're running a bit out of time.
Okay,
thank you.
No problem. Next one, please. Next slide. Next slide, please. It's not moving.
Next slide, please. Well, feel free to wrap up while we figure out the technical issues, Dr. Abba. Thank you very much.
Okay. Okay. So can I proceed?
Yes, please. Yes,
Yeah.
please. Proceed.
Okay. So I think the important analysis that we can derive from this is this has been the worst outbreak for Mauritius, and there are several factors that could have contributed to it: cyclone, flash floods, and persistent rainfall. Mauritius, being said, needs increased attention for EPR. I think EPR is now starting to gain attention in Mauritius. We need to ensure that there's sustained attention to EPR with funds, resources, as Mauritius relies heavily on tourism. Insecticide resistance, a major concern, is currently being addressed. Several other things that could have contributed further: community mobilization and lack of preparedness, as well as multi-sectoral approaches. Next, please. So the several challenges reflect what I've discussed.
I think the time, we are running out of time, Dr. Abba. So if you can wrap up and give the conclusions in 20 seconds so we can move to the next speaker. Thank you.
This is our next step. So can we go to the last slide, which is the next step? Last one, next one. Yeah, so next steps, review of the dengue response in Mauritius, an operational interaction review required. We need to relook at a human resource capacity and institutional capacity, emergency workforce strategy, insecticide resistance surveillance system, and integration of all other viruses, including Zika and chikungunya, enhance quality of documentation and publications on dengue, including best practices, challenges, and effective data sharing to contribute to global dengue dashboard. That's it for me. Can we go to the last slides, please? Thank you.
Thank you very much for sharing with us all the challenges and lessons learned and the situation in Mauritius. I'm sure we are going to have a good discussion. There are a few questions from the audience for you later. So now let me give the floor to Dr. Lidia Viñal Frutoso, who is the head of the National Surveillance of Arbovirus in the Department of Communicable Diseases in the Ministry of Health of Brazil. So Dr. Lidia, over to you.
Obrigada.
Thank you. I want to wish you a great day, good evening, good night. Thank you for your invitation for WHO for participating in this webinar. May we start? The next one, please. Next slide. So I need to say a bit about our country, which is a continental extension land. We are over 200,000 million, and we are divided in 25 states. And we have a climate which is quite diverse, and we have from temperature from 25 to 27 degrees and abundant, lots of rain during the whole year. It's also important to highlight that we have a unified health system. It's a free system. Anyone can access this health system, and it's formed by three federated institutions. So the Ministry of Health formulates the policy. We also some material and diagnosis material, but the state also participates and supports the cities. But inside the cities is that all the surveillance happen, where there are some assistance that we can organize to help all the surveillance and notification. Next one. Here is our history. Since 1986, we have a systematic register of cases of dengue in Brazil. We had some epidemic along the series, usually caused by change of serotype, because dengue 1 is prevailing for a long time. And this year, as you can see in this bar of 2024, we have circulation of dengue 1 and 2, and it's an outbreak never seen before in our history. The year of 2024 corresponds to the total of cases that overcame a number of cases of the period from 2021, 22, and 23 combined. So it has been an outbreak which is quite challenging for the country. So here we have 5.8 million probable cases notified, with over almost 3,000 deaths and more than 3,000 under investigation. Part of those cases are confirmed, but Brazil also used the clinical and epidemiological criteria. 40% are confirmed by laboratory, and we have a positivity index rate around 37%. The bars in dark blue graph are the cases of 2024, and the light blue 2023. As we can see here, cases are reducing, but we still have high levels, including the week of 21 was higher than the amount of cases that we have in the peak of transmission of the year 2023. Next one. We also have some chikungunya notifications that's a really lower compared to the others, as was said by other experts. We have a definition of case which is quite similar. And so many cases that could be considered as chikungunya, they are notified as dengue. So we have this under notification in Brazil. And Zika is being detected, but we have a lower rate of detection, and most of cases are confirmed by lab, and we use the EGM technology. It can have some relation to the dengue, so that's an additional challenge to detect those cases. We also have another arbovirus that are concerning us, which is oral post fever. As we can see at the left, in the colored area in the map represents the states of the north part of Brazil, which already had some endemic situation, but in 2024, we can see it spread to other countries, to other states and other areas like the southeast and south and northeast, and the symptoms are quite similar to dengue. So the dengue and Zika and chikungunya negative cases, some part of the samples are being tested. As we go further in this testing, we can identify other cases of oral push fever. So about the challenges we have in Brazil. We have a vector that's quite distributed. In the first map in 1995, we have around 1,700 cities. In 2014, around 45 infested and cities, and increased that in 2024. The circulation, this moment, we have 4 types of serotype. I'm sorry for this map here. We don't have the dengue 4, but we have 4 types of dengue. We had a rapid change from serotype from 1 to 2 in some areas of the country, and this might have contributed to the surge, this big outbreak that we had this year. There are also many cities in Brazil that present a historical series of high transmission. From over 5,000 cities, most of them has less than 10,000 inhabitants, but there are some cities that represent itself over 52, almost 52% of the cities on the people are infected. So if we take a look here, the number of cities, we have a high incidence, but there are high magnitude of dengue in the history of dengue. We have high concentration of cases in some cities of the country. Next one, please. We have to mention also the climate change. As what was mentioned before, we had the hottest year in the last 125 years of our planet. And there are many consequences. As we can see on the right, the Rio Negro, the biggest river in the Amazon, it had a drought. The biggest one, it had an increase of temperature in the south of Brazil. We had a short winter since last year. It also contributes to this situation we have this year. And we need to talk about the social determinants. Most of irregular constructions in Brazil have no sanitation and in collection of garbage, and over 48% of people have no access to basic sanitation. Another challenge is the circulation of different arboviruses. On the left, you can see the blue areas in which the number of positive of chikungunya was higher than chikungunya. And the left, we see the system of notification of cases, showing that notification usually is considered dengue, and this usually considered dengue and not the proper chikungunya. So we had many actions to prepare for that. First one, it happened in August when we gathered many experts to try to deal the review of clinical management guidelines for dengue and chikungunya. Our guidelines were from 2016, so we had this need to include more issues to deal with clinical management. We also had a meeting in the same month to deal and to talk about the national guideline for control and vector. So in that guideline, we had many technologies to control it and the way it can be used to have a better control. And the guideline is ready, and we decided not to publish it right now during the epidemic. We'll do this in the next few months, considering the situation, preparing for the next year. We already had this alert from the WHO, and so we asked a few cruise institutions a modeling of data that could help us to what could be expected for Brazil this year. So in September, this modeling saying that we could have around 1.9 million cases, could vary from 1.4 to over 4 million. We know that those modeling can be dynamic. Those are data that we collect up to September. We overcame these cases, but it was important to have this kind of modeling so we can manage many things in the area of health and thinking about the preparation for the outbreak of dengue. So we had a meeting in October. We gathered 27 states and 40 cities that are highly endemic, and we worked with the plan of contingency, risk stratification, OV traps, and we talk about residual spray and Wolbachia in this meeting. So we had 210 people in just one workshop in Brazil. So as for preparation, we published 2 alert notes. We talk about this increase of cases. So cities and states should be prepared, implemented a national arbovirus room to make monitoring. We are working every weekend, and we are working intensely when it comes to surveillance, control, and investigation to help all the cities and state. We open a purchase process to buy all the equipment and medication. We transfer also resources, over 47 million, and we also had training for doctors and nurses in 27 states using the new guidelines that were already reviewed. So now, talking about emergency response, we have a contingency plan, and this plan works with an endemic channel. And in the beginning of the year, we already were in the level 3 with an incidence over our limit and with some deaths confirmed since the beginning of this year. And we know when we are in the epidemic moment, all the effort should be done, although we won't not leave the control of factors, but we should focus on training people and organizing services, because the goal was to decrease some higher cases and deaths. We have a comprehensive assistance, and it needs to have qualified professionals. We work with stratification of risk for a long time. There are some issues about addition for this risk, but we emphasize and we at least offer the oral hydration, and we monitor all the patients that need support. The capacity of this network needs to be expanded. We implemented in the day in February 24, and this operation center is still under work. We had 128 activation days, 58 daily and weekly reports published and in 10 states. And also 183 cities decreed emergency of dengue, and all those points in the maps, they received support from the health of ministry. So we had 16 local support groups that helped and worked with the Ministry of Health and cities. We distributed serology tests and also larvicides and residual adulticide and over adulticide for UBV. Here's to show primary health care. As I said before, it helped over 1.5 million people with suspect of dengue. And it's important to say that this first attention covers over almost 80% of the population in Brazil. So it's quite important. It can help us if we strengthen this network of health. I know I don't have much time, but just to show you our updated version of dengue management guide. So here we have risk classification, and we published this year a leaflet about dengue during pregnancy. We also updated the flowchart for chikungunya, which is available to be published. We still need to fix some things, but we are working hard on that, so we can publish this year yet. We also have other material like contingency plan and a guide for health surveillance. We also have short videos to help training about arboviruses for all the healthcare professionals. Here is an example of webinar. We did many webinars along the time. Here's the link for those who want to see it. Here another webinar with over 10,000 doctors that participate from this webinar. It's a training for dengue management. We have some. So we're also working with behavior science, why people don't do what they need to do, what they know they need to do. So we need trying to understand that, and we say that 75% of breeding spots are inside people's home. And we had two important meetings. One, to debate with experts. It happened in April, and to understand our response to dengue. In May, we also had a workshop to prepare for 2024-2025. We have many challenges. Here's my last slide. As challenges, we have laboratory diagnosis, and we need to improve that since we have epidemic here. We need to deal with resistance factors. We have less molecules that are effective. We also have issues with case definitions. The diseases are quite similar, so it doesn't help to identify the disease. We need to have a robust and timely information system, but we don't have this for all the arboviruses, so we're investing in the information system. There are also many other things that, as for example, we need to improve their capacity of response. So we had, although we had a lot of efforts, we had a huge epidemic and with a lot of death. We need to improve and change the population behavior, need to have a public policy structure, as well as permanent investment in research, and also preparation of new managers, because this year we have a huge challenge. We have city elections, and in October a lot of things will change because it will change all the mayors. So we are concerned about this issue when it comes to 2025. Well, I won't talk about the new technologies. The next one, I think, is the last one. Thank you so much. Here's our team. Thank you for the opportunity to share our experience with you.
Muito obrigado, Doutora Lívia. Well, thank you very much to all the speakers. I think we have a full overview of the current dengue situation in the global level, how WHO has been supporting countries and regions in this emergency response. And now we have also two experiences from two countries that are different in size, in transmission dynamics, and by the timing that these viruses have been circulating. So we had Mauritius, where dengue has been recently introduced, and they have seen a large outbreak this year, and they are still building the surveillance system and have lots of lessons learned and challenges, in contrast with the situation in Brazil that have had dengue transmission for decades already, and they have multiple arboviruses co-circulating at the same time, such as chikungunya, Zika, and now an emerging arbovirus such as a Oropouche virus. So I think we went through all the presentations, and hopefully the presentations are useful for all the participants. So I have a couple of questions for the panelists from the countries. So can you please share with the audience one lesson learned from this recent outbreak, and which advice would you give to the countries where the season is just starting? So let's start with Dr. Lívia, and then we go with Dr. Abba. Dr. Lívia, over to you.
Well, I consider that's quite challenging. I think we need to work more and more with elements that will help us to have an idea what's coming in the future. Now we are facing this new challenge. We'll have another year with an epidemic. So I think that it's important to have surveillance and to work in the moment of low transmission, that's when what kind of virus are circulating, where we can take the more spots of breeding, and we can just raise awareness in the population. I think that's the ideal moment to work and to get ready for assistance, because we had an overload of assistance, and I think it was important to understand this experience of Mauritius Island with the home care. It's kind of complex to deal with all the demands of health, and including a layer of epidemic. So my advice is just prepare your teams and do as much as you can when it comes to prevention.
Thank you very much, Dr. Abba. Do you want to share with us one of the lessons learned and advice for the participants on this EPI-WIN? Over to you.
Thank you. Yes, I think for Mauritius, the most important lesson learned is emergency coordination. Emergency coordination has been good, but it still remains a gap there, because we've realized with dengue, a lot of sectors have to work together, and talking well in between the sectors and ensuring there is synchrony in activities, does help a lot. Intersectoral and outside communication equally is quite important. So for us, this is the most important lesson learned. And I would also add to that preparedness. The country was prepared, but not for such a big outbreak. Thank you.
Thank you very much. I think two really good advices, and they are the same. Doesn't matter how much transmission do you have in the country. Prepare, prepare, and prepare. And the low transmission season is when the country should prepare, train the doctors to early detect, and also on clinical management of dengue and other arboviruses. And super key, the multi-sectorial coordination, because it's not just the responsibility of the health sector, but how to have this multi-sectorial team that is ready to prevent and also to control and respond to these outbreaks. So unfortunately, we are running out of time. I think it was a really good session, and we had the chance to hear all the talks. We will be replying to the questions that were posted in the Q&A. By email or what we discussed with our EPI-WIN colleagues how to do it. We have questions. There's a lot of interest about the surveillance system, the differences between the surveillance systems in the regions and in the even within countries. So I think that's we have regions where still the 1997 case definition is used. We have regions where the 2009, and we are currently updating case definition and the clinical management guidance that will be hopefully ready by the end of this year. So we will try to reply to all your questions, and well, thank you very much to all the speakers and to all of you for joining this session. I will give the floor now to Sadrish to close this webinar. Thank you.
Just thank everyone. All right. Now that we've come to our allotted time, I'd just like to wrap up by again saying thank you to everyone that's joined us, especially the panelists and speakers, and then the people at the back end working on this webinar as well. And thank you to all the participants who's joined and submitted the questions. As Diana mentioned, we'll try to answer all of them. If you want to keep updated on the future EPI-WIN webinars, please do subscribe to our mailing list. And we hope you'll join us for the next EPI-WIN webinar on the 20th. Please do save the date. It's the same link that you've registered with this webinar. So please do join us on the 20th. And thank you so much, and we hope to see you next week.